This is Pathways to Prevention, the podcast that sparks conversations shaping the future of drug prevention and recovery. Powered by the Drug-Free America Foundation, we bring together leading voices like policymakers, researchers, faith leaders, prevention experts, and real-world changemakers to tackle the biggest challenges in the fight against substance misuse. From breaking trends to innovative strategies, we explore what works, what's next, and how we can all make an impact. You're here because you care about creating a world free from the grip of addiction. Together, we'll uncover the stories, solutions, and strategies that drive meaningful change. Thank you for listening. Now, let's get started.
All right. Welcome to another episode of the Pathways to Prevention podcast, the podcast where we highlight the incredible work happening in the world of prevention, treatment, and recovery. I'm your host, Dave Closson. Today, we're diving into a conversation that's going to bring a fresh perspective on youth prevention and community-based strategies. Joining me is Emily Hill, a dedicated drug-free communities coordinator from Minnesota. Emily has been leading prevention efforts in her community, working on initiatives to educate youth, parents, and local stakeholders about substance use prevention. And with a background in coalition work, she has been at the forefront of addressing key issues like cannabis legalization, opioid education, and youth engagement. In this episode, we're going to explore Emily's journey into prevention, her work with the Youth Advisory Coalition, and the real impact grassroots prevention efforts have in shaping healthier communities. We'll also discuss some of the challenges and opportunities she's encountered, especially in navigating Minnesota's evolving cannabis laws and how her coalition is responding. So whether you're a prevention professional, coalition leader, or just someone passionate about community change, this episode is packed with insights you won't want to miss. So let's dive in. Emily, welcome to the podcast.
Thank you, Dave, and thank you, the Pathway to Prevention audience. I'm excited to be here.
I've been looking forward to this conversation, and I shared a little bit, we'll call it a teaser, as far as your background, your role, what you do for work, and where you're located. But I'm hoping you might share a little bit about your background and kind of what led you into the prevention field.
Well, to be completely honest, it was an accident. I was in high school, really looking to work in the healthcare field, but didn't want to be in the hospital. I kind of went into college as undecided, had never heard of public health before, took some public health classes by the guidance of a really good counselor at the University of Iowa, and then that's when I got led into global health. So I actually studied global health in college because I was really interested in people and culture. And to be honest, beyond college, I never pictured myself in the prevention world. I still didn't even know prevention existed. Once I graduated and I was looking for jobs, it was the post-COVID market, so it was pretty low in terms of opportunity. But I did come across a new, program through the AmeriCorps branch, which many people know about. They now have a public health corps. So really just getting, usually it's like new people, like undergraduates and people trying to explore public health to get experience, even people like mid-career wanting to shift. And so I was part of the first cohort of the Public Health Corps back in 2022. And I was originally supposed to do family health. And then I left and then I got the opportunity to work closer to home and do opioid. On my first day, they had an opioid advisory committee meeting and I was set to take notes. And I was at the front of the room writing on the poster board and they were saying like fentanyl and xylazine. And I was up there like, I don't even know how to spell this. I was writing with xylazine with a Z. I had never heard of this before. So it was being thrown right into it, but it quickly caught my attention and my passion. And I've been in the field ever since. And I love it. And I'm looking forward to how the field will become professionalized over the years and start to have some standards as other health fields in across all dimensions, whether it's medical, mental health, etc.
I like it. And I'm guilty of using acronyms, but I just realized as a DFC, drug-free community coordinator, and with our global audience, not everybody might be familiar with that. So I kind of have a two-part question. Could you give us kind of a high-level overview of what a drug-free community is and sort of what inspired you to step into that role of a DFC coordinator?
Of course, yeah. So, like I mentioned, I came in as an opioid in the public health core. But while I was doing that work, I also worked under the previous coordinator for drug-free community. So what is drug-free community? It's a federal level grant that goes out. They are in every state in the U.S. And they grant on a 5-year cycle, $125,000 a year for 5 years, and then you can be renewed up to 10 years. The drug-free community, the main factor to be a DFC is to have a coalition. And those coalitions have 12 sectors from around the community, including youth, parents, businesses, healthcare, law enforcement, to name a few. But there's 12 sectors. You need to have one person of every sector at least as like a minimum to be that coalition. And then obviously you can have additional people in all the fields as well. And the two main goals of DFC is to mobilize community, kind of bring them together and get them working on the same topic that everyone's concerned about and everyone's doing work on. But how can we do that together? How can we mobilize and make a bigger effort? And what is that effort? To reduce youth substance use. All communities are required to choose four substances. You don't have to choose 4 substances, but we did choose 4 substances. We chose alcohol, tobacco, cannabis, and then opioids, including like prescription drugs, fentanyl, etc. Just because those are affecting our community directly, but every coalition is different. So they get to pick the substances that directly affect them based off of the data they receive from that community.
Okay. And what kind of pulled you into stepping into that role of coordinator?
Again, I wouldn't say an accident, just more so luck this time, I guess. Like I mentioned, I was working under the previous coordinator in our community, doing work with them, while also doing that opioid work I was brought on to do with AmeriCorps. And that person ended up leaving the role, and I applied, and here I am. But really, again, it was that passion from learning about this field, learning about prevention, and everything I am able to do. I enjoy everyone on my coalition. They're all great leaders in our community, and we've had kind of a rough patch with COVID. We did get awarded in 2019. So we did struggle for a while there, just kind of having it during COVID, but we're trying to rebound. We're trying to be innovative, have new ideas. And I think it's fun to be the person behind the ideas and trying to orchestrate something new.
Yes. And in our planning call, I know you kind of shared that a little bit, and I know we'll get into some of that, the wisdom that has come out of that experience of leading a coalition, of building a coalition through a global pandemic. Just that life experience alone, you got a ton of wisdom to share with us. But we'll save that for a little bit later in our conversation. And I really want to just hear a little bit about that passion piece. What do you love most about working in prevention?
Man, that's a hard question. There's so much. There's just so much to it. To me, this is what I've been looking for my whole life. When I started thinking about what do I want to be when I grow up. Prevention is working with people. It is working cross-culturally and including that language piece that I learned about in my global health years. It includes working with youth, with the younger generation, in prevention saves lives. And that's what I was always looking for with prevention. I was always looking at treatment, and I would shadow doctors, and it wasn't what I wanted to do. And prevention is. And I mean, prevention goes across everything, obviously. The substance use piece, I mean, it never really affected me personally, but I was still there when that vaping started going out. And that was around high school I was in, and I remember people starting to vape. I remember I would vape in cars with high school friends, and then in college, like most of my friends would at the parties, it would be everywhere. And it's something too that, like, again, not directly affecting me, and not to the degree of knowing someone who is overdosed or gone further down the line of severity, I would say, in terms of the effects substance use can have on people. But now being in this job, I've met many people with experiences like that, and it's part of my heart. It's what I do. I'm so passionate about it. I love my job. I love the work I do, and I think prevention is the answer to saving the world.
Mm-hmm. And there's a soundbite right there. And like my time as a college police officer in Illinois, it didn't take me long to realize how many of my calls for service, the things I had to go, quote, deal with as a police officer, were somewhat related, had alcohol or other drugs involved. Like the impacts were astounding, But yeah, that was just kind of an eye opener for me, with just seeing how many things were influenced by substances, the negative impacts they have. It just helped push me over the edge to be team prevention and dedicate my life to it. But hey, enough about me. I want to know more about, what does it look like to build a coalition? Like, you got funded in 2019, right before the pandemic. You talked about the 12 sectors and the aspect that prevention is all about community and people. But what does coalition building look like? How did you do that?
I don't want to take the credit for building the coalition. I did come in later. So the previous coordinators have done excellent jobs, and I still am in contact with them today for advice. I would say more it's reinventing it. I think coming into as a young professional and having these new ideas, having new ways to work with social media, having an easier time connecting with the younger generation, the people we're targeting for, and understanding what their experience is, has just helped me see the coalition's work in a different way. And how can we be innovative? How can we change what we're doing? Not that what we're doing was bad, like that stuff's still good, but what can we do in addition? Like what are some new steps we could take? And it was on the horizon. It wasn't that I thought of it, but one of the things I did take on was building a youth advisory committee. So actually getting student voices our coalition table so they can be directly bridged to the students that they're directly serving.
So that sort of you're kind of that translator, that go between the I'll call it, dare I say, older adults, people my age, and the youth voices as well. So you advocated for the youth, you brought them in to your coalition, gave them a seat at the table, and not just a seat at the table, and I'm putting words in your mouth here, but also gave them a voice at the table. Not just, come sit here and be a part of it, but we want to hear your voice as well. And tell me a little bit more about, like what you see as the role the youth play in your prevention efforts in your coalition.
And that's still building every day. We're progressing. So the first year, they were just brought into conception and the end of 2023, so December of 2023. And that first year was more so like building, getting youth involved, starting to figure out like what can we do together? Where can I take them? What are their like capabilities? Like a lot of the things we came up with right away is I can't do in-person meetings if I have students who can't drive. I have people who physically can't get to places. We have to like adapt via Zoom. And again, like even the age levels, we have 6th graders through 12th graders. So the maturity level and the ranges of topics we can talk about and address just very differently. So that first year is kind of figuring that out and trying to expand to multiple school districts, because we do, as a drug-free community coalition, we do serve our whole entire county. So we had 3, we're at 2 school districts right now, but we're trying to get to all 5. And what does that look like going forward? How can that be sustainable? What I'm really trying to build on now. But something new that hasn't happened yet, which I'm sad that I can't speak more to it yet, but something that I changed for this year, now that we've had a year with Youth Advisory Committee and I had that relationship with them, we're starting to build, we're gaining momentum. I'm actually now changed the coalition's meeting times for this year. They usually meet during the day because that's what works for a lot of people. Well, that doesn't work for students. So how can I get students to the table? So this year I actually changed. So every other meeting, I'm still keeping them at the same meeting time. So for those who can't do it later in the day can still attend the coalition meeting. But every other month, we are having them at after school hours. So our students can actually come to the coalition table to come speak with adults, come network with adults. And so March is going to be our first meeting with the students there. And I'm actually been preparing with some students to do a big presentation because they just hosted their own student-led listening session around substance use and mental health. They're going to kind of present that data to our adult coalition and hopefully keep going to the meeting onward. But I am nervous because it's the first after work hours coalition meeting. So, but I think everyone's super excited that the students are going to be there. So I think we'll have a good turnout, but I am nervous that people are going to be like, I don't want to stay late.
As you talk about the first year, figuring stuff out, the maturity levels, what topics you can talk to them about, what topics you can't, and a whole bunch of stuff. What are some of the lessons you've learned on how do you even begin to figure that stuff out?
Yeah, I mean, it was really one day at a time. I think, to be quite honest, I didn't, if I could redo how I started the Youth Advisory Coalition, looking back now, I would have planned better for it before starting it. I did plan for I planned for it, but looking back in terms of sustainability and the lessons I learned just in terms of those different maturity levels and the transportation, I feel like I would have oriented it differently. But it's really just been 1 month at a time or one conversation at a time. I think too, reflecting off my own experience, I didn't know what fentanyl was until I was post-college graduate. But these students, I remember the first day I just kind of did the first meeting, I had an overview of the substances and kind of gauging where people were at. And they all knew about opioids. They all knew about fentanyl. They had overdoses in their school. And it shocks me that they knew that, because I, at their age, had no idea. I mean, at my 23 years old, I had no idea still. And so I think just talking to them has opened my eyes to and it's really helped the prevention world, because again, you understand their world better. And it all social media, plus obviously that personal school experience taught everyone, but that social media people learned so much. But really, it's just been one meeting at a time, figuring out learning lessons, taking it back. I did go tour quite a few other student coalition groups in the metro area. So but I should have did that, again, I would have done that before I started my own, going back. But doing that meanwhile and learning so much from going to those groups, having contact with people across counties to reach out and be like, hey, what do you do related to this? Or what do you do related to that? Has really just helped evolve. I've actually been to other counties to present how I do my youth advisory committee as well, so that they learn and are prepared and they can do it better when they actually do it themselves. So that's one thing. Really just been one day at a time and learning as I go.
Yeah, one day at a time, listening to the youth and learning at every point. Okay. Mm-hmm. There's one other thing I want to I'll say zoom in on or kind of tease out a little bit. You mentioned the schools and wanting to get into, was it all 5 schools? Mm-hmm. How do you, quote, get into a school? How does one go about doing that?
Yeah. So when I refer to getting into the school, what I've been doing is the connections I have at the school, like the chemical health counselor or the principal or teacher or superintendent, just presenting them with my flyer I have about the Youth Advisory Coalition, and then they would put it on their TVs that circulate the school, or they would send it out in a newsletter. All our schools also have meetings between community partners that assist in the school and school counselors and school teachers and school staff that are available to go. And I attend all of those. So I bring the flyer for the Youth Advisory Committee every time. I speak about what our students are doing. And a lot of the students that have now were recommended by a counselor. We presented to advisory classes, so people were able to sign up via our presentation. So that obviously engaged people more than seeing a flyer on a TV. But yeah, that's really what we've done to get in the school.
One of the big things I heard there was meeting them where they're at, going to their meetings, going to their events, having a presence and multiple points of contact, not just an email with an ask and I didn't hear anything, so I guess I'm not going to get in that school. A little bit of persistence?
Persistence. I go, yes. Every single interagency meeting I'm there. I mean, I have other things I bring with me. So the schools have, I have my resources, I have other things going on, but I always have that flyer, and I always talk about, again, now this next meetings I get to go to, I get to talk about the student-led listening session they conducted, to be look at your student could be a part of this. We could bring this to your school and we could replicate it at your school. So yeah, it's definitely consistency and like you said, meeting them where they're at, because you can't expect everyone to come to you.
Right. Yes. And you'd shared a little bit about, when you were just kind of gauging the youth's knowledge on the different substances, and you're blown away, you're shocked at how much they knew for their ages. So I'm wondering if there have been any other like moments where their perspective or one of their perspectives really just shifted something for you about, how you think about prevention or growing up as a youth in this day and age.
I mean, there's a lot of things that just came to my mind like at once. Like, I think one of the big things that really gets in my perspective as well, I was meeting with this one student, and we wanted to do a cannabis presentation to county government employees to inform them about the new cannabis legislation in Minnesota. And then we were going to have like a student perspective side of it. And we sat down to the planning meeting, and they just started asking me all these questions that made me stop and realize, like, yeah, like, what is the point? Like, what am I asking them to do? Like, I'm just providing education, but like, what are the action steps? Like, what else? How could we do more? Like there's something more you could always do. Like, it's pointless to just send information out in the world, especially if it's towards people's lunchtime. Are they even going to pay attention? Like, what makes them care? Can we get like higher government officials in there? Can we get state government officials in there to make it more serious, make it more? And I was just like, I mean, it's great. Like, I'm glad that they think that way. And then they know they can do more and we can do more. And they wanted to expand it across 3 sessions. They wanted to have a discussion session, make them actually work for it. So that was one that really stood out to me, because we postponed that to this summer when they have more time, so we can do it this summer when they're not in school, and we can actually plan out like a more elaborate, make it more of like a 3-part webinar, in-person webinar, or whatever, conference series to really try to get the most impact out of it. And again, that came directly from the student, not even me, the professional, if you want to say that. Like, I was like, I mean, yeah, you're right. Like, education is one thing, but there's a lot of factors that go into it.
That just tells me how much they care. That alone, like, they care, they're motivated, they want to make a difference, they want to do stuff. So we as the adult guides or professionals, like, let's get out of their way. Let's help empower them to do that, step into that role.
Yeah, absolutely.
That's cool. Before we shift and start really talking about navigating cannabis legalization, I want to know more about the youth listening session. Can you give us just a quick rundown on what led to that, or what is it? How'd it go? Tell us that story.
Yeah. The student-led listening session, it wasn't my idea either. The student-led listening session came out of, again, one of our youth advisory committee students. Summer, there was an opportunity for our students to go participate in a listening session with someone from the federal level was facilitating listening sessions of students across the United States. I sent the opportunity to the youth advisory committee. This one student had gone, and they really loved the experience they had. And I don't even remember at what point we talked about replicating it, but like, they lead the session. Like, why don't we repeat it? But now let's do it at your school, and you lead it. So let's make it student led. And I have my old AmeriCorps person right now, actually Public Health Corps, who's assisting with me with drug-free community. So they really took the lead with that student on this project too. And we opened it up to other students at this specific high school. We wanted to keep it to the one high school just to start, because we weren't really sure what to expect. And so we kind of just put a flyer out there to see who would show up. We got a lot of applications, actually. We had to deny students, which we were surprised. We didn't even think we would get enough. And so we picked one from each grade. We had 9, 10, 11, 12 to kind of get the whole high school involved. And we started meeting with them weekly. So we met with them every week for about 50 minutes after school. We started planning. We had a whole action plan out, talking about like, okay, let's figure out the logistics. What date, when are we going to host it? What time? Is it going to be before school, after school? Like, what food are we going to provide? Like, which classroom can we do it? What space feels comfortable, but still like professional, but also confidential, because we're going to be talking about confidential things. And then we kind of moved into like, well, what do we want to know? Like, what is it that we want to learn from students? Like, why are they coming? Like, what are we gonna do with this once we receive information from the students? What are our next steps? And even getting into the like, okay, let's pretend we get 50 people who want to come to the session. Well, we can't hold a listening session with 50 people. How are we going to stop the survey responses at 16? Are we going to let all 50 apply and then hand pick? Are we going to try to keep it like the ratio of gender, or try to include all races or LGBTQ identifying? Like, do we want to screen for any of those factors so it's more representation of the high school? And so kind of working through those questions. And a lot of the students, I think, had never really considered some of those things before. So it was really cool to kind of work through that with them and see what they came up with. Like I said, they picked everything. We kind of came with some ideas, and then what they had, and they blew us out of the water with their ideas, with their effort. Winter break was over it, so we had to find everyone kind of like a little project to do over the 2 weeks we weren't going to meet. They had them designing the actual sign-up survey, the flyer. One student created like a resource sheet where people didn't just leave the session with nothing. They had a whole resource sheet, and we were just thinking about like list like your school and like some community resources. And the student listed applications, like free apps that you can download on your phone for meditation, like Spotify, like podcasts, or Spotify. Even had like music playlists in there, like again, above and beyond, like more than we expected them to do. And the other one was doing a recruitment plan. So creating that step by step, who's going to do school announcements, which day, who's going to reach out, who's going to post the flyers. And it all came together. We had a community partner too, who trained the students on how to be facilitators. So they actually had a formal training, how it would go. We had a practice session with adults. So, and then the day of the session, it went really well. Time went so fast. We were like, had to end, even though we had more questions, and we got so much information. I mean, the students who led it and the students who were there participating, it was phenomenal. And now we're in the after phases. So we debrief, and now we're gonna plan for our presentation again, like I mentioned, to the coalition with the results we had.
That is so powerful and so fulfilling to just hear that story, that journey that, it was adult guided, but still youth led. And it just reminds me to the past episode where I got to meet the youth from the 11th Asian Youth Forum that went to that, and how it was that collective wisdom of the youth that was just inspiring when they were provided an opportunity to share their voices and be heard and be valued. It's just a beautiful thing when folks create the space to do that for youth, and that's cool. I'm glad you shared that story with us.
It was cool. Yeah.
We'll have to have you back on to hear how the presentation portion goes.
Yeah. And hopefully we can replicate it because we have those other students. So we're now looking into doing it at a different high school with those students now, once we get to that point. But
one step at a time, one day at a time, one step at a time. All right. Well, our next step on this journey, if you're so willing to venture there with me, would be around navigating cannabis legalization. And in Minnesota, recently, in air quotes, legalized cannabis. And I can only imagine how that could have impacted your work as a DFC coalition coordinator. But I'd just be guessing and imagining. So maybe can you tell us a little bit about how has that impacted your work?
I mean, absolutely. Cannabis has consumed the work, as you may imagine. This started way back, again, before I was the DFC coordinator, back when I was doing that opioid AmeriCorps term in 2022. That's when Minnesota actually legalized low potency hemp edible. It was July 2022, so the month before I started as the opioid person. And so I was here for opioids, and I did do opioids, but I did a lot of cannabis. That first year, we had passed moratorium, so our stores couldn't sell within our county, and so it was a lot of work of like educating stores, so going around to like the smoke shops and the liquor stores and the grocery stores and being like, and just seeing and being like, hey, just so you know, like our community is under moratorium, even though the state law says it's legal to sell these products now, it's actually not. legal in our county. So just kind of putting together a little infographic of the rules and when that moratorium would list in each city was different, with like a QR code. And time passed obviously, and we can only do so much with public health. We're not law enforcement. So it was more so just kind of gathering information and spreading that education around our community and kind of starting to prepare, because that's when the talks of full-on legalization were going on. And I spent the second half of my AmeriCorps term, in addition to opioid, reading that cannabis legislation as it changed and how it went through the statute, the House, Senate. Stepping into drug-free communities, obviously by then it had been legal. So we did legalize it fully in August of 2023, the following year. We still had yet to give out licensing for full-on cannabis businesses, but we still do have that local hemp edible market in our state. So yeah, it's taken over quite a bit of my time, and our state has a new grant that went out to all community health boards. So they are all going to be receiving some money to do some cannabis and substance use prevention, education, and policy system and environmental work. There is like requirements for a curriculum, for all schools in the state are going to have to add in cannabis curriculum that's approved by the state. I'm trying to think what else is like a big thing to touch on. I feel like those are the big ones I can really touch on.
Pretty good insight on how it completely rocked your world and work and threw things just completely different direction. What would be sort of I'll call it a highlight reel of that quick little short 3 bullet point list of maybe some of the biggest challenges that you ran into when it comes to educating youth, parents, community members related to cannabis use or harm reduction?
Yeah, I think there's a lot of big challenges, I would say. I mean, first of all, the biggest one that I do hear quite often is it's just weed, it's just cannabis. So that misperception of in the 70s and 80s, a lot of people were, well, of all time, people were smoking, but really in the 70s, 80s, 90s, when today's parents were smoking cannabis, it was a plant. Oh, it is a plant, but the potency of those products were much lower than they are today. They're in the 1, 2, 3, 4% in that potency. And today, the cannabis that is being consumed by young people are up in the 90% potency. And that potency is that key factor that we're really trying to educate, that it's not a plant that they're smoking. It's synthetic cannabis. It's gone through chemical procedures to make it stronger, to make it more effective, for the effects to last longer. And as you can imagine, it's much more damaging, especially to those young minds that are still developing.
That's something that just, like, the first time I saw somebody present and make that point, they had the pictures of the flower, it's just weed, it's just grass, it's natural. And they talked about potency, but then that next image was of a chemistry lab. And like, this is today's marijuana. This is today's cannabis. This is where it's being made. It's being modified, engineered. It's not all natural. It's not. Yeah, like that, like my eyes were like, whoa, got real big when I saw that. Absolutely. And so among all of those challenges and the work that you've been doing since before it was actually legalized there in Minnesota, what might be a couple nuggets of advice you'd give to our listeners that might be navigating a similar policy change?
Ooh, advice. Well, I think like connecting with parents in more meaningful ways that are not as like judgmental. A lot of people just aren't aware. So we've had some parent classes. We've done both like a vaping, so like kind of like, can you identify the vape in this bucket of school supplies, and like kind of educating parents how vapes look different, but then also having that added component of like, you don't know what's in the vape. It could be nicotine, it could be cannabis. Both can be flavored to berry. And again, you're not necessarily going to know. And a lot of times the students smoking or consuming the vape also don't know like what's necessarily in there, what other chemicals could be in there. I've also done some like edible cannabis. So we went around and purchased edible products from around the state of Minnesota, and then I went to Target. Within 10 minutes, I found similar replicas of those edible cannabis products. This one looks exactly like cough drops. This one looks exactly like a pack of gum. This one looks exactly like this candy. And just kind of, again, showing that comparison to parents in a non-judgmental way, but just to be like, hey, like, if you're going to consume this in your home, like, that's fine, but just be aware that if your kid sees, like, this cannabis gummy packet, they might think it's the icebreaker gum. Like, the packaging is so similar. And even though Minnesota passed laws that prohibit that flashy advertising and marketing that's toward youth, they're still going to add color. They're still going to add the pops and the little like fireworks or whatever else you want to put on the packaging to draw people in. I mean, even if you're not marketing directly toward youth, that packaging still works for the adult market. Adults are still more attracted to packaging that's not just plain and simple. So I think too, like going forward with that non-judgmental piece. For me, I think if you're also a parent, maybe it's easier to connect with other parents. I'm personally not a parent, so I think a lot of times when I'm talking to someone, I'm more coming at them as a way of like, this is how your child may be viewing it, talking to you as a parent. But maybe also having that parent-to-parent perspective might be something different. Obviously, you can't just become a parent to do prevention work that way, but I think that's something that maybe is different for when I talk to parents, just as someone who's not a parent myself. Touching back on some more challenges, because I only listed one, and I have some more for you.
Yeah, bring them on. On.
Going back to the challenges too, I think another big challenge is the medical cannabis market and it being medicine in certain situations, but a lot of people taking it very literal that it's medicine. And it can't, if I can get a med card or medicine card and consume cannabis, like what's the difference with me then consuming it recreationally? It's all beneficial to my health. I think is that underlying piece that people get stuck on. So another challenge is the social media aspect, and touching back on that too, in the listening session, the students kept touching on it as well, that a lot of students, when they start using, a lot of times they'll be influencers on social media, like reviewing a vape brand online, or review someone talking about the new crazy strain of cannabis that was created. And that entices people and intrigues them. I mean, they're called influencers for a reason. The point is to influence people to do certain behaviors or act a certain way. Is hard to combat in the prevention world as well, because prevention messaging gets buried. How do you compete with an influencer who has a lot of status as followers and is talking about something that is seen as cool by some young people, these prevention messaging, and how do you kind of go about that in connecting with young people, and that has been a challenge, I would say. I mean, obviously the young people I'm connected to aren't necessarily involved in the behavior, but then when you talk to them too about like what can be done, it kind of like silences the room, like what can be done. Another one too that comes with the legalization, the big one that I should have started at the beginning, is that community norm. That's the hardest part to prevent and like kind of go again, because now you're seeing cannabis in the gas station. You're seeing it obviously there's smoke shops and there's going to be cannabis shops, and like those will be like seen by distance by young people, but they go into the gas station, they go into the grocery stores, they go into restaurants and bars that now have THC beverage menu. They are exposed to this norm, to the cannabis leaf being around their community, and that really decreases their perception of the harm of the substance, because why can adults in my community go around and consume this of free will, and what's wrong with me doing it myself? We've even had some cannabis events that have been talked about, brought up, and done in our community, and the entire event is revolved around the cannabis industry. And again, just that messaging and what that showed to the young people in our community, that it's safe and people can do it once you're 21. But again, just like if that explanation is not given clear as day to young people, to them it's just a suggestion. And how do you combat that when it's visible every day, while they're walking to school, while they're driving around, on the billboards they drive by on the highway, you there's so much money in the industry that they can do these advertisements. They have the ability and the power to be so present in our community and to change that community norm that the prevention world just doesn't have. We only have so many grants. We only have so many private donations and ability to combat their presence in the community. And that legalization just is kind of like the green stamp again on it. Like it makes it safer. It makes it seem safer in people's minds to consume, just because it's now a legal substance to consume. Now you're only breaking the law of you're underage, not necessarily it's illegal.
Mm-hmm. So many things, just taking back to the team at One Choice, and just, yes, all the above, just underlining everything that you said. Yeah, it is a challenge. And one of my good friends, Dr. Jeff Linkenbach, one of his quotes is, if you want health, promote health. So when you look around at all the billboards, the smoke shops and everything, that's what the community is promoting, because that's the what's out there, the conversation that's shaping the norms and the culture of that community. But if you want health, promote health. Yeah. Well, kind of along that trend of promoting health, I want to zoom out a little bit to that bigger picture level, not just honed in on cannabis. You know, you've done work with other substances. You've got the 4 that your coalition picked. You've got that long history of working with opioid education and hearing from the youth, talking about messaging when it comes to navigating cannabis legalization. How do you approach prevention messaging so that it does resonate with youth, with parents, with those local community stakeholders?
And that's a really great question, and something that I have another recent example for you, which I'm really excited about. We recently just put together a little like mini team within the coalition to really work on a new prevention billboard message. And that was something that we really sat and debated for a while. We're like, well, who actually reads billboard? Likely more parents and adults in our community rather than young people. So let's make our next prevention billboard like directly towards parents. And so we went right into parental attitude and parental norm around vaping. So we kind of did a little billboard saying, it was like, we went off of the Lung Mind Alliance, get your head out of the cloud was our inspiration. So again, just kind of taking our idea of like a parent head in the clouds and being like, my kid would never vape. And we actually used local statistics from our student survey saying, but 1 in 6 like local students do try vaping in our community. And it was like, get your head out of the clouds, and like had those like resource link on there and the ads. So really just trying to target the parent, because we were thinking how, like, who's going to read our billboard? Probably parents. And a lot of the feedback I've gotten from our previous billboards are from parents and adults in our community, not necessarily the young people. And then that's where for young people, it's more like, okay, let's get our messaging on Instagram. Let's get our messaging. We would love to get to the point of doing like videos, because videos are the big thing. It's just going to take time to get there. But our youth advisory committee has created an Instagram, and they have a logo now. So getting them up and running. So it's peer-to-peer messaging, peer-to-peer influence. And again, like local stakeholders, it's more formal communication, I would say. It's getting them involved and not only like having them come to my coalition meeting, but getting to their meeting, going to their late night church basement meeting and bringing the information I know there, so that they're knowing what's going on in our community. It's going to their early morning 7:30 a.m. meetings at a local town hall. Okay, it's both ways, but really just bringing that information to them in more of a formal presentation email way, just because that's more of like the professional world, and it's more about spreading like, this is what we're doing, this is what we have going on, what do you have going on, and kind of learning from each other, and then finding where we can connect and partner and have something come out of it.
Mm-hmm. Absolutely. And if you haven't checked them out on Instagram yet, you should check out the account Hey I'm Here Ohio. You might find their content interesting, inspiring, as you work with your youth and creating their own Instagram. Hey, I'm Here Ohio is a adult-guided, youth-led, statewide mental health and resilience campaign program that's meant to give the youth a space to talk about their lives, the ups, the downs, the challenges, the joys, the stresses, and the youth are creating the content. It's pretty cool.
That.
It's pretty cool, and happy to introduce you to them too if you want to get connected with them to chat. But
I love that. I'd love to check that out, and I'm all for cross-state connections.
Yes, right. We got to learn from each other. We got to compare notes and share stories and help lift each other up. Absolutely. And talked about community norms, which brings me back to another Dr. Jeff Linkenbach quote to set up my next question. And the quote is that if perception is reality, then so too are misperceptions. And so along that line of misperceptions, misconceptions about prevention work, what's one or two that maybe you want to debunk, a misperception about prevention work or prevention?
I would say the biggest, I don't know if it's considered a misperception or just more of like a lack of understanding of what prevention is and what my job is. My mom's trouble. She's going to listen to this episode and she's going to be so mad I called her out. But like, I mean, even people in my family, they don't even know how to describe what I do to when people ask. They're like, oh, what does Emily do? And they're just kind of like, oh, she prevents drugs. Like, you know, it's kind of just like that lack of understanding of everything that goes on behind the scenes in the prevention world, and then that connection and that social piece of knowing who to talk to, when to talk to them, the time it takes to create and build those bonds to be able to have community connections. Again, for me, it was easier with a coalition. I have so many people to reach out to, so many people that know my name, that know what we're trying to do. And even if they don't, they know someone on my coalition and they can introduce me to that person. But that behind the scenes work and all the stuff I do, I think gets lost in translation and what is prevention. Well, I mean, I'm busy every day. I mean, today, yeah, there's meetings, but there's also preparing for outreach, ordering more materials to give out to the community, thinking about new creative ways. Like, okay, we probably need a new billboard. It's been up for a year. Like, let's start planning around for a new one. Or what are some other ways we can reach out to people? I really think the biggest misconception is just like people not understanding what I do. And a lot of it is collaboration. Like those meetings are meeting with people from around the state, meeting people around the country, around the world even, to figure out what other people are doing. How can we get this message across? Because it's not as simple as it seems. I wish there was one big billboard that everyone had to read like every single day, but people don't do that. And not only that, like then you throw into the factors of culture, of language. And how do you get this message into a different language, but not only just the different language, the different culture, like the cultural norms around substances and different substances are so different. And you can't just put a message into a different language and expect it to drive the message home. You have to then know stakeholders in those communities who can bring that message in a way that hit for that community, in a way that they'll understand what you're trying to do. There's just so many like layers to the job that I think people don't necessarily understand, which is fair. I didn't even know either until getting into the job. But connecting with the whole community means connecting with the whole community. And not only culturally, you can think of age. Like I keep mentioning, like social media for young people, well, the newspaper for the older generation. Like how can I get myself into all of the above? How maybe I could go to the radio, but young people don't listen to it anymore. They listen to their streaming apps on their phone. But the older generation, they listen to the radio. So like how can I get my message far and wide, but then translate it for every niche community that everyone gets the same message, not necessarily word for word, but they get the same idea behind that one message. And I think that's the biggest kind of misconception or lack of understanding of prevention, is how complex it actually is.
You're not alone in that feeling. My wife dreads it when people ask her, so what does your husband do?
Yep.
Yes. Okay. Well, I want to continue down this kind of thinking. I've got just a couple questions left if you're up for it.
Hmm.
What is just one piece of wisdom you would share with somebody just starting out in prevention?
I think my biggest piece of advice for someone new starting out in the prevention field, whether it be substance use or any other type of prevention, is really that open-mindedness piece, the piece of there's a lot to learn and you're not going to know all of it when you start, and it's normal to learn along the way. Even though I know I mentioned before how I wish I could do the youth advisory committee differently and had known everything before I started, I wouldn't be where I am today without starting it and learning as you go. Now, the next time I do a youth advisory committee, I'm going to have a better understanding and idea how to do it. But when you're starting out, you learn what you can online from webinars and training sources, peer bosses, but really it's doing it yourself and try to be, you have a new way of thinking about it. Prevention work keeps changing and is always changing because new people are coming in with new ideas. The culture is changing, the times are changing, and that's, it's fun about prevention. It's always different. You can always be creative and think of new ways to do things. And I would just really recommend someone who's open-minded and loves to chit-chat and meet new people. It's pretty extroverted work. I'm an introvert, so it was something. And this is something someone from my coalition actually said to me recently too, because I had asked them, because they are just like they are a connector in the community. They are a huge name, like everyone knows who they are, and they're a great person. And I was talking to them, and I was like, I'm just curious, are you an introvert or an extrovert? Like, and they're an extrovert, which makes sense to me. And I was like, yeah, I'm an introvert, and like, previously, if I had to present in front of 5 people, I would get so nervous. And like, here I am presenting in front of 50 teachers. Here I am presenting in front of 100 like elected officials. Here I am like talking to people all day long. And they were like, yeah, well, when it's something you're passionate about, it makes it easier. It makes it just come out of you in ways that you never thought possible. And I thought that was pretty cool way of thinking about it.
Yeah, that is. And like my perspective or paradigm has shifted too, because I'm also an introvert and I would label myself that way. But then I would say, I'm an introvert that's learned how to be an extrovert. But then as I continue to deepen my self-knowledge, I've realized that when it comes to like your own personalities, we are also dynamic. It's not an either or. You can be both.
Mm-hmm.
And so now I look at it more around like an energy. What brings me energy? What drains my energy? And looking at it that way, because in some situations, I can be very extroverted. Some situations, I can be very introverted. So I don't think it's an either or. And
that's a great way to look at it.
Yeah.
I like the energy piece.
Yeah. I think about like what drains your battery and what recharges your battery. And it doesn't have to be, just this or that. It can be, speaking to 5 people, speaking to 100 people, that whole spectrum. Yeah. Energy. Yeah. All right. Well, if you've got enough energy, I have 2 questions left, I think. 2 questions. I want to know about your hopes, your dreams, your visions for the future of your prevention work in your community. What do you hope for in the future?
Ooh, one of the big, I guess, hopes and goals I'm working toward, specifically, again, back to that youth advisory committee. What we're really going for is to get that group established in each school, managed by someone in that school district that can meet with them then in person, and they can do projects related to their school district, because each school district has such different needs, but then still having that county piece, where my goal and dream is then to host, like every summer, to host like a big get together of all these advisory committee students from around the counties to come together, and we'll have like a picnic and like networking and hanging out, and like maybe we can plan some big countywide events or things like that once we get established on the line. But my big dream for the youth advisory committee would to kind of go down that route, just because, again, too, as we expand, the needs are so different across the schools, and I think that's the way it goes. So once I have that in place, that would be really cool to have everybody again then doing their own prevention work and being able to expand much wider within their school district, have that direct like effect and effort in their school, where at lunch all the students are going to go together and table at lunch, for example, which is something that we can't do as a county-wide just because we're all at different schools. For the community as a whole, my biggest hope is we just keep learning and growing. Everyone, I can't say everyone, but like people's hearts are in it. People recognize in our community that substance use and especially youth substance use is something that affects people on a larger scale. Like you mentioned before, it's not just alcoholism. It's way beyond that. It's vaping in cars. It's getting into accidents. It's fighting or being verbally aggressive and even getting into like the mental health world that I don't want to touch too heavily on because they're so interconnected, but it goes beyond and it affects every aspect of our lives. And in our community, we do recognize it. I mean, there's obviously still misconceptions and things we're working towards, but my real ideal is just for everyone to keep doing the work, to keep educating students, to keep educating each other and the community. I obviously my real hope is that no youth in our county ever use again, but I know how unrealistic that is, and that's not necessarily really a goal of mine, even though it is on paper for drug-free communities. But
like, can we work ourselves out of a job?
I know, right? That would be cool. Yeah.
All right. Last question. Hopefully this will be the easiest question of this quote interview, conversation, however you want to label this time we've spent together. I'm curious, where can listeners learn more about your coalition and or get connected, stay connected? I know you talk social media, but yeah, how can we all get connected?
Yeah. We have a website. I don't know the link off the top of my head, but I'll make sure it's sent to you. It's something/drug-free community. So we have a website. Okay. We have a website. I am in the process of kind of updating it. It's a little outdated just from COVID and again, catching back up on everything, but all our information is there. My information's there if anyone's interested in reaching out. Something I am more up to date on is our Instagram, SC Drug Free. So I try to post there and post the coalition and the youth advisory committee why every month, multiple times a month if I have the time and ability and things that are going on. And the youth advisory committee also has an Instagram. They don't have any posts yet, but hopefully if you want to follow and then in the future they'll get some going. Trying to get back on Facebook again. So hopefully you can find us there soon. And yeah, that's all we're at right now.
Cool. Well, yeah, listeners, check the show notes, get connected, and let's lift up each other in the world of social media so we can learn and help spread all of our positive messaging to make this world a little bit healthier, a little bit safer, and a little bit happier. So, open space, any last final parting words of wisdom or thoughts before we hit the old stop recording?
I guess my final thoughts are maybe to recent graduates, other young professionals out there, the opportunities are there. Our office has started to take on some more young professionals into roles, and I work in a public health office. So having young minds together and our experiences together has been really meaningful. I love who I call my moms in the office and the older generation. I hate calling them that, but they also have super valuable experiences and things to learn from. They know it all and are great guides. But yes, I just want to shout out the young professionals because we're the next gen to shout out the Drug Free America Foundation.
And that link will be in the show notes as well. And I'm gonna take what you said and put it in my own words because I'm the host and I can because it was so beautiful in that, hey, young professionals, the prevention field is real. There are careers here that are rewarding and fulfilling. And to quote the one and only Emily Hill, prevention is how we're going to change the world.
There we go.
Yeah, there we go. You're doing it. You are a prevention leader and you are changing the world. Thanks for playing along and taking all of these questions I was throwing your way in stride and sharing your wisdom with not just me, but literally sharing your wisdom with the world. Thank you. And
Thank you.
Keep rocking. More to come.
Good. Thank you.
Thank you for joining us on this episode of Pathways to Prevention, brought to you by the Drug Free America Foundation. Together, we're building a future where communities thrive and individuals live free from the burden of substance misuse. If you found this conversation valuable, don't forget to subscribe and share it with others who care about making a difference. Your support helps us reach even more listeners around the world. To stay connected and explore more resources, visit us online at dfaf.org. Let's continue to spark conversations, drive change, and create pathways to a healthier, drug-free future. Until next time, thank you for listening and for being part of this mission.